Hi, I'm Dr. Shirley North from North Star Physical Therapy. And for this very quick video, we are going to discuss the collaboration between pelvic floor physical therapists and personal trainers. A lot of folks think physical therapists are glorified personal trainers. Well, that's not true. We have a vast medical knowledge and specialize in several different areas of the body and body systems. So that way we can help you meet your goals with whatever symptom you may have. For example, I am a pelvic floor physical therapist, and what's very unique to me is that I treat everyone, every pelvis. There are several pelvic floor physical therapists out there that only treat the peripartum and postpartum female, which is absolutely needed. However, I think a very much underserved community is with our male clients, and absolutely underserved are those within the LGBTQ community. And so I feel everybody has a pelvis, everybody deserves optimal health, and that includes their bladder health for any kind of symptom dealing with your urinary function. For example, if someone with a penis has any kind of urinary hesitancy or any kind of leakage, that can also happen with the other genitalia as well. So if there's any kind of urinary symptom like urinary incontinence when you jump, laugh, cough, when you're trying to progress that exercise with your personal trainer and you're just not quite comfortable in doing the jumping, not quite comfortable in bumping up those weights because the more that you push, the potential leakage that may occur, you need pelvic floor physical therapy. There's also bowel health. We want to make sure there's no constipation or fecal leakage either. They're having nice, healthy bowel movements, and that your system, your posture, your positioning, your breathing technique, and pressure management doesn't cause other symptoms like pelvic pain, pelvic pressure, pelvic organ prolapse, any hernias, and yes, someone with a penis could also develop hernias and can also have what's called diastasis recti, the separation of the abdominal muscles because of that pressure management issue. So it's not just the postpartum mom that needs pelvic floor physical therapy, but every pelvis. We absolutely need to make sure sexual function is as optimal and that pain is nowhere in the equation, no matter if you are the penetrator or the penetratee during that physical act with whatever is being used for that, or even just a level of intimacy, just even stimulation. So for those that may have difficulty with reaching climax or that it's painful, or for those that it's painful being penetrated or being the penetrator, there's hypersensitivity there, or maybe tightness, or maybe it's just difficult to achieve that optimal arousal without discomfort or just at all. So again, no matter what kind of genitalia you have, there are muscles, there are ligaments, there are tendons, there is blood flow, there are nerves. All of that is factored in more than just looking at the muscles. Okay, and that's something that a pelvic floor physical therapist works on and assesses and seeing individualizing the care to you. We want to make sure the soft tissue in that area isn't irritated or doesn't, change that much because of blood flow, either restrictions, because maybe a tight muscle, or how we're positioned throughout the day, how we're sitting on our exercise bike, for example. And so those are also things that we take into consideration, your hormonal health. So yes, this absolutely captures the menopausal person, but also males and those with testosterone dominant systems, you also go through hormonal changes too, and that can affect the genitalia. Maybe medication related, maybe medical treatment like radiation or chemo. because of a cancer diagnosis. So just those quick few minutes here, I laid out so many different conditions and symptoms that a pelvic floor physical therapist and many, many more things that we specialize in and that we can help. More importantly, we collaborate with other team members, especially for someone that's already seeing a personal trainer, that we want to make sure that that trainer is aware that maybe if we're working on something within our pelvic floor treatment, that we can communicate from provider to provider what's the best course of action in progressing forward, so that way symptoms can be resolved and not come back. We want to be able to build up resilience within your system with that strength, with that flexibility, with that endurance, with that blood flow, with that positioning. You see how involved and how comprehensive we can be. So I love to collaborate with other providers, other specialists within the medical side, but I think also within the allied healthcare professional side, with massage therapists, personal trainers, chiropractors, functional medicine providers, yoga instructors, Pilates instructors. The list is endless, really, right? So we love to be able to collaborate with those. And I feel that is such an underserved side. And so please feel free to check out some other little tips and tricks from my social media pages on Facebook with North Star Physical Therapy, on Instagram at Dr. Shirley North, and also on my website at www.northstardpt.com. Feel free to check out my podcast where I get way more in depth of these different conditions. And so that way you can be a self-advocate. So even if there's a family or friend, you're just asking for a friend, right? Because this is a very, private and particular area of the body. And we want to respect that as well. So even if you want to reach out for a private virtual consultation, I am here for you. So we can be able to discuss and coordinate together on who is the best provider for you. Even if you're not within the Northern Virginia area here, I have folks that reach out to me from many different states or even different part of Virginia to just get that education, get that collaboration, so that I can be your guiding light to optimal pelvic health. Thank you so much for listening, and I look forward to connecting with you soon.